Every day here on your 5 News First at 4, we've been welcoming local doctors and medical professionals to discuss the COVID-19 pandemic. Today, we are joined by Dr. Jennifer Dillaha with the Arkansas Department of Health. Doctor, thanks for being with us this afternoon.
I'm really glad to be here. Thank you for having me.
So every day we've been hearing from the governor and the Secretary of the Department of Health, Dr. Nate Smith, about the impacts statewide. But we'd love to hear from you this afternoon. Can you tell us how the virus is spreading specifically in Northwest Arkansas and the River Valley?
Well, we know that this virus is spreading in the community. So that means that people who are carrying the virus may be undiagnosed, and then they are coming into contact with people either in their homes or their work, and those people are being exposed to it. So it's a very good thing that there's lots of testing available in Northwest Arkansas, because if someone knows that they're positive, then they need to stay at home in isolation and keep from going out and exposing other people. And that's very key to stopping the spread, is for people who are known to be infected, not sick enough to be in the hospital, but they should not go to work, they should not be out in public, they should stay at home.
You mentioned the testing availability in Northwest Arkansas. We know there is less availability in the River Valley. Why is there such a big difference in testing sites between these two regions?
Well, we find that we have a great variability and availability of tests all around the state. So it's been up to many of the local healthcare providers, hospitals, and clinics to arrange with commercial labs to be able to provide the testing. So it depends on where the clinics and the hospitals are located. And we know that in some areas we do have a shortage of healthcare providers, and that could be part of the problem. So now we have other entities, stores like Walmart, and then CVS and Walgreens that are working on making the test available in areas where it has not been previously available.
Talk about the current testing qualifications. We have been reporting that you have to be symptomatic and that you have to have a known contact with a positive patient. You mentioned that community spread, so why is that known contact still something that's being considered if someone could have contact with a positive patient without their knowledge?
Well, it depends on which system you're going through. So the tests that are available through the Arkansas Department of Health are high priority patients, very sick patients in the hospital, people who are known contacts to cases, people who live in congregate living situations like nursing homes or prisons and so forth. We prioritize those because of the ramifications that if you do have a positive case, and we can have very quick turnarounds. The commercial labs that are providing tests available through hospitals and clinics have much more ability to have discretion. So it's not necessary that a person have a known contact. If a person is symptomatic and that with symptoms that are consistent with COVID-19, such as fever, cough, shortness of breath, then those people can be tested and they should be tested.
And are they being tested?
I have not personally checked with those clinics in that area, but I believe because of the numbers of tests being done around the state that, yes, they are being tested.
Okay. We did learn yesterday that at least 2 state lawmakers have tested positive for COVID-19, and we learned that one of them said he wasn't showing symptoms. So how was he able to get tested when other asymptomatic people are not being tested? And in fact, those who are symptomatic are being sent home if they're not bad enough.
Well, I cannot speak directly about that lawmaker, but there are situations when people are have a known exposure, and because of the situations, then they have been tested, and it has to do with the implications for large potential for exposures, like in a group. So those that are not symptomatic can still be tested, but we are asking that they not be the priority, that the priority be people who are ill, who have symptoms. But it's up to the discretion of the healthcare provider who is making the test available to determine who will be tested.
So what you're saying is on an individual basis, that healthcare provider can say that someone not feeling symptomatic but feels like they should be tested could potentially be tested over someone who is showing symptoms.
It's the healthcare provider's discretion.
All right. Let me ask you this question quickly before we go to our first commercial break. Are the numbers accurate in showing that the virus seems to be spreading slower in Northwest Arkansas as compared to Central Arkansas, or is that a discrepancy with the amount of people being tested?
I have not personally analyzed that, so I don't think I can answer that question, but we do monitor that. We have a whole staff of epidemiologists here at the Arkansas Department of Health who are tracking the virus where it's tested positive. One concern we have, of course, is that locations that have little testing have few positive tests, and that makes sense. So we really want to increase access to testing. That does give us some comfort in Northwest Arkansas, where the access to testing is relatively good compared to the rest of the state.
All right, Dr. Jennifer Dillaha, thank you for your answers. We'll have more questions for you coming up after the break. First, though, let's check in with Garrett for a look at your forecast. All right, Garrett, thanks. Back now this afternoon with Dr. Jennifer Dillaha with the Arkansas Department of Health. She's joining us to answer more of your questions about the COVID-19 pandemic. Doctor, I want to start with testing one more time. I know on the Arkansas Department of Health's website, on the dashboard that shows us the map of the state, you can see the different number of tests in different counties. We're able to see that Benton and Washington counties combined have tested almost 1,000 patients. Pope County, for instance, has tested more than 400, yet Crawford and Sebastian counties combined have tested only 100 patients. Is this something that you're concerned about, knowing that Fort Smith is the second largest city in this state?
Yes, that we are concerned that we can expand testing in Arkansas. So there is another map on the website that shows the locations of where testing is available in the communities. And we see that the places, of course, with the lower number of positive tests are the places that have fewer facilities that are doing testing. And we're hoping that that can be expanded in Arkansas. Many of those places are places where they don't have the number of healthcare providers needed to do the testing. So we're hopeful that pharmacies, such as those with the chains such as Walmart, CVS, Walgreens, and others, can ramp up the testing and make that available in those communities where there is little community testing possible at this time.
And when you're talking about using these private businesses, then would they be responsible for paying for this testing as well?
So the testing would be part of their venture. This is not something the health department is doing through them. We're encouraging them and we're giving them guidance, but that is something that they would have to arrange for with a commercial lab. And then the payment would be arranged in the way that many traditional payments are paid for, insurance or Medicaid or Medicare, but there is also federal funding available for covering the costs of tests.
So the funding is there. It's a matter of having those private providers step up and offer those tests.
Yes, either private providers, such as those commercial or the chain stores. Many pharmacies are looking into providing the tests when they're in locations where there's not clinics that can do it.
Okay. On another note, we're told that by local doctors that they're using one mask all day, and they're told to take those masks home, store them in a paper bag for 3 days before reusing them. Is that typical protocol?
So nationally, there is a shortage of what we call protective personal equipment. And those are things like masks, eye protection like face guards or goggles, gowns, and gloves. And that has been a problem from the beginning of the spread of COVID-19 in the U.S. The situation is improving. There are more companies coming on board with making it. And so we are hopeful that what will be available to healthcare providers will improve. One thing I would like to say is that many people in the community would like also to wear masks. And that's important because masks can help prevent the spread of COVID-19. So the Arkansas Department of Health has put a pattern on our website so that people can sew their own cloth masks. The purpose of those masks would be to prevent the spread of droplets from coughing or sneezing that people give off when they are infected, and those masks block it. So if they can wear a cloth mask and not use up one of the medical masks that the healthcare providers needs, that would be wonderful. And then they can launder them and reuse them. So we're encouraging people around the state, if they want to wear a mask, especially if they have symptoms or they're concerned they may be a carrier for it, then they can wear those masks. It may make them feel safer and more secure. And so we're encouraging people to go ahead and make them and wear them.
Even those that are seemingly healthy or asymptomatic, do you suggest that they wear them as well?
Well, it's going to be up to the individual. Right now, there's not a great deal of evidence that it prevents people from getting the disease, but it may help people keep from spreading it if they have it. So there is no harm in wearing those masks. And if people want to do that, then I would say go for it.
All right, Doctor, thank you. We appreciate it. We'll have more questions for you on the other side of this break. Back now with Dr. Jennifer Dillaha with the Arkansas Department of Health. Before the break, we were talking about the state's use of personal protective equipment. I think one question a lot of people have is, how is that PPE being distributed, and is it getting to Northwest Arkansas and the River Valley, or is there a concern of shortage here in our area of the state?
So the Arkansas Department of Health is working with the Arkansas healthcare coalitions around the state, as well as the Division of Emergency Management and other groups, to prioritize the distribution of the PPE around the state. I haven't looked personally specifically at the plans for Northwest Arkansas, but there's no reason to believe that the Northwest Arkansas would be of any lower priority than any area. I think they're working to distribute those available PPE products as equitably and as fairly as possible around the state. And I think that's important because the healthcare coalitions are the districts or the areas around the state where the hospitals and the clinics and other healthcare entities are working together to plan for what they will do as the number of patients increase and the burden on the healthcare system increases. So it's going to be important for them all to have the PPE that they need.
On another topic, we've gotten some calls from concerned parents who say K through 12 students are at home, but daycare centers are still open. And do having those daycare centers open defeat the purpose of K through 12 students being home, because we have children congregating together in these daycares?
So that is a really important issue. You know, there are a lot of people who still need to go to work, especially our healthcare providers, and they may have children that need care. So we've worked with many daycares and schools to provide child care for these families so that the essential employees can go to work. However, the way that they are operated is done in a way to minimize congregation of these children in larger groups, to spread them out and have them work separately in smaller groups so that the opportunity for spread of the virus is minimized. It's not a perfect situation, but it's important that people who must go to work are able to do so, and that means that someone will need to take care of their children. And we're working really hard to make sure it's done in the most effective and strategy possible to prevent the spread of COVID-19.
Yeah, sounds like the lesser of two evils in this case, right? You have to choose one over the other. Okay.
Yes.
Answer us this. We know that people are being tested. How long does it take to process a test? And why may some people be getting their results in a couple of days and others may have to wait a week or more?
So it depends on which commercial lab that the clinic or the hospital or the facility where they got the test sends it to. Some commercial labs have a larger backlog than others, and of course those tests are not run in Arkansas, they're shipped off, and then those results may take a while. Now, I think many of those commercial labs have increased or ramped up their capacity, so the wait time or the lag is shorter than it used to be. But there has been a great surge, as you've noticed, in the number of tests available, and most of those are done through commercial labs.
Good.
So it's a balance between increasing the capacity and ramping up the ability to quickly turn around those tests.
All right, we appreciate your time this afternoon. We'll be back with you in a final thought after the break.